Welcome back, everyone. We're still on the heart, but we're going to talk a little bit about blood pressure here. Okay. So here's two slides. One is, let's see, this one here. We're going to talk about what happens if there's an increase in blood pressure, and then we'll talk about if there's a decrease in blood pressure. So if there's something that's causing a rise in blood pressure, the arterial blood pressure is rising above normal range, and we have baroreceptors, right? Like a barometer reading in the weather report. We have baroreceptors, pressure receptors in the carotid arteries, in the carotid sinus, and other pressure receptors in the aortic arch off of the heart. Okay. Now, when it picks up, hey, we've got too much pressure going on here. We don't want to have a heart attack. We don't want to have a stroke. Let's try and decrease the blood pressure. So the impulses are traveling along afferent nerves. Afferent means sensory nerves. From the baroreceptors, they're going to stimulate the center within the neural system. That's the cardioinhibitory center. So the neural system is going to send signals to decrease the sympathetic output, to decrease sympathetic impulses. Remember, sympathetic is fight or flight response, running to get away from danger. Your heart's going to pump, your breathing is going to be accelerated, your pupils are going to dilate. So if you decrease sympathetic impulse, you're decreasing your heart rate, you're decreasing the contractility, so you're decreasing cardiac output. And at the same point in time, when the sympathetics are inhibited, we are going to get vasodilation. We're going to get increased vessel diameter. If we look at the lumen here, this is opening up, which means that there's less resistance. Decreased, the arrow down, decreased R is decreased resistance. If the lumen is open, you have decreased resistance, and if it shortens and constricts, you're going to get increased resistance. So with decreased cardiac output and decreased resistance, you're going to get homeostasis to blood pressure. You know how else you can decrease resistance? By thinning out the blood. If you thin out the blood, you can decrease resistance. That's why many use baby aspirins. Some use Coumadin or warfarin. Some take a more holistic and a natural approach by using garlic and using resveratrol and using fish oils and using niacin, using natocerazines. These are all things that can also thin out the blood a little bit. Okay, now we have something that's decreasing the blood pressure. So now we want to increase it. So kind of like a similar thing where now we have the arterial blood pressure falls below the normal range. And once again, we've got these baroreceptors that are in the carotid sinus and the aortic arch. They're picking up this information. Now it's going to send the information to the neural system, to the vasomotor center, and these signals are going to now increase the sympathetic output, which is going to increase the heart rate and increase the contractility force of the heart, which increases the cardiac output. And the sympathetics are involved in vasoconstriction of the blood vessel. When you vasoconstrict, you're going to increase the peripheral resistance in the blood vessels. So if you increase cardiac output and you increase the resistance, you're going to increase blood pressure, and we have homeostasis once again. What are some of the chemicals that can increase blood pressure? Some of these should be a little bit of a review because these were covered in endocrinology. The adrenal gland has the adrenal medulla, and in the adrenal medulla, we can push out adrenaline and noradrenaline, aka epinephrine and norepinephrine. Those are capable of increasing blood pressure. Now, in the hypothalamus produces ADH, and it's stored in the posterior pituitary, antidiuretic hormone. That causes intense vasoconstriction in case there's extreme low blood pressure. If you vasoconstrict, you're going to increase blood pressure once again. Then we have angiotensin 2. Angiotensin 2. Your kidneys release renin. How do we know that? Look at the first three letters of renin is rene, like renal. Renal is kidney. So the kidneys produce renin, and what renin does, renin converts angiotensinogen into angiotensin 1. And then angiotensin 1 gets converted into angiotensin 2. The way that angiotensin 1 gets converted into angiotensin 2 is by an enzyme called angiotensin converting enzyme. So angiotensin 1 gets converted into angiotensin 2 by angiotensin converting enzyme, and that is released by the lungs. So we're talking about blood pressure, and look what's involved. Not just the heart, but you got the kidneys and you got the lungs. Okay, so the liver is what produced angiotensin ogin. So the liver produced this is one word, angiotensinogen, but anything that ends in ogin is inactive. So renin, which is produced by the kidneys, knocks off the ogin and creates angiotensin 1. And then angiotensin 1 gets converted to angiotensin 2 by angiotensin converting enzyme that's produced by the lungs. What a story. Isn't that amazing? All these things involved in blood pressure, the liver, the kidneys, the lungs. Okay? So angiotensin 2 is involved in blood pressure goes. What's involved in decreasing blood pressure? Well, the heart makes a hormone called ANP, which is atrial natriuretic peptide. In the word natriuretic, this comes from the word natrium. And if we take the first two letters of natrium, that's Na. What is NaCl? That's sodium chloride. We're talking about salt. That's sodium. Atrial natriuretic peptide is involved in natrium, in sodium. If the blood pressure gets too high, the heart produces ANP to get rid of sodium. If you get rid of sodium, you're going to lose a little salt, you're going to lose a little water, blood volume and blood pressure declines. Okay, nitric oxide. Nitric oxide is a vasodilator. Nitric oxide is produced from an amino acid called arginine. Arginine. That's why a lot of bodybuilders supplement and a lot of athletes supplement with arginine because they want to drive more oxygen, right? They want to drive more blood and oxygen into their muscles. The only way they can do that is if the blood vessels dilate, they could rush more blood to those areas. So they supplement with arginine, which is a precursor to nitric oxide. You know what happens if people have LDL cholesterol that's oxidized? If you have low density lipoproteins that are oxidized or damaged LDLs block nitric oxide. They inhibit nitric oxide's function. So guess what happens to the blood vessels? They cannot dilate. So if you have high cholesterol that's damaged, LDLs are oxidized, it impairs nitric oxide, you can get high blood pressure. What else can decrease blood pressure? Histamine. Histamine is a vasodilator. Prostacyclins, they thin the blood. These are all vasodilators. And alcohol can cause the blood pressure to drop because it inhibits antidiuretic hormone by inhibiting antidiuretic hormone. Okay? Okay, so we went over the kidneys. I went over this already. Um, we went over this, but here's the picture. This is kind of like going over the RAS system, the renin, aldosterone, angiotensin system. So if you have decreased blood pressure, the baroreceptors pick that up and it's going to send a signal to the kidneys. The kidneys make renin. We said renin is going to um, convert angiotensinogen into angiotensin 1. And then angiotensin 1, I'll call it here, angiotensin 1 gets converted into angiotensin 2 right here by way of angiotensin converting enzyme. Okay, what is angiotensin 2 going to do? It is going to be stimulating the adrenal cortex, right? We have aldosterone secretion by the adrenal cortex. That's a mineral corticoid. And aldosterone is going to increase sodium reabsorption, whereas antidiuretic hormone is going to increase water absorption. So if you eat salt and you drink water and you hold on to it, blood volume is going to increase and arterial pressure is going to increase. Okay? And also when you get sympathetic stimulation, you get vasoconstriction of blood vessels. So all of that's going to increase blood pressure. This is where you can actually feel pulses, temporal artery. In smokers, smokers, heavy smokers can get something called temporal arteritis. A lot of pain and sensitivity here can actually lead to blindness, so we want to be careful with that. Here's the common carotid artery when you have runners that feel their pulse right near the SCM muscle. Here's the brachial artery. We use that for blood pressure. When we want to feel the pulse, it's the radial artery. Here's the femoral artery. Here, the popliteal is behind the knee. Here's the posterior tibial, right near the medial malleolus. And then here's the dorsal pedal. Now, in men, this is kind of easier to see in men. Poor circulation to the lower extremities often results in erectile dysfunction when there's poor blood supply to the lower extremity. But typically, it's predictable if you look at the lower legs from around this region here, you'll see that a lot of older men don't have any hair down there. If you have poor circulation, you're not going to have hair. It's going to be a weak pulse at the dorsal pedal, weak pulse here, most likely a weak pulse here. The stronger these distal pulses, the better the blood supply, the less chance of erectile dysfunction. Okay, that's a little FYI here. And normal blood pressure, we want it less than 120 over 80. Systolic over diastolic. What is systolic? That's the pressure of blood in the vessels when the heart is depolarizing, when it's contracting. And diastole is the pressure between the heartbeats when the heart is relaxing or repolarizing. Okay? High blood pressure, 140 over 90 or higher. Prehypertension is anything between 120 to 139, and normal blood pressure is less than 120 over 80. Okay? Okay.